Okay, good afternoon, everyone, and welcome to our webinar. Thank you for joining us today. And before we begin, just a quick note for better audio quality and the smooth flow of the webinar, and to protect your privacy, all participants' microphones and cameras will be turned off. You can communicate with us through the chat anytime. Please note that this webinar is being recorded, and we will send you the recording within 2 working days after today's session. Okay, let me first briefly introduce our team today. We have Dr. Irena Folauf, who will guide you through the medical part.
Irena Folauf, nice to meet you.
And our coordinator, Maria, who will support you throughout the process. Hello. And my name is Jelena. I'm also coordinator, and I will be your moderator today. Today's topic is why IVF doesn't work even when you've done everything right, let's say. This is one of the most common and also most frustrating questions patients have. Many patients come to us after one or more unsuccessful attempts and feeling confused and often asking the same questions. Why didn't it work if everything was done correctly? So in today's webinar, we will try to explain the key factors that can influence the outcome and help you better understand what might be happening in these situations. We will start with a short presentation by Dr. Folauf and then move on to your questions. If you would like to ask a question during the webinar, please use a chat function. You will find the chat icon in the top bar. If we don't manage to answer all of your questions during the webinar, we will follow up with you by email. Okay, so now I will hand over to Dr. Irena Folauf, who will take you through the topic in more detail.
Thank you, Jelena.
Today, I will talk about why treatment sometimes fails, even when everything is done correctly. Of course, the key factors for the success are oocytes, sperms, and the endometrium. The woman therefore has a double role. She provides oocytes and the environment for embryo implantation. Both the quantity and quality of oocytes naturally decline with age. Ovarian reserve is usually assessed using AMH, anti-Müllerian hormone, which can be easily measured in blood, and AFC, which is evaluated by ultrasound. Both the number and the quality of oocytes decline significantly after the age of 35. This is something like magical number for us. This is not the woman's fault, it's simply biology. With increasing maternal age, the rate of chromosomal abnormalities increases. This leads to poorer embryo development, implantation failure, and a higher risk of miscarriage and congenital abnormalities. This is my favorite quote. It's not only about eggs. Pregnancy is always the result of the interaction between two cells. Sperms are not only carriers of genetic information. In a semen analysis, in spermiogram, we check concentration, movement, and shape of sperms. Unfortunately, a normal spermiogram doesn't automatically mean optimal sperm quality. Sometimes also additional tests are needed. What can affect the sperm quality? Age, stress, obesity, smoking, and the whole lifestyle. Even a high-quality embryo needs a well-developed and receptive endometrium. Modern reproductive medicine can support optimal endometrial preparation. For example, we can offer you Sanakin. Sanakin is a modified autologous serum. It's used to help the endometrium become more receptive for implantation. It can improve the chances of a successful pregnancy.
In addition to what doctor said, I would only like to add that the process is very simple and easy to arrange. You need to come usually one day before transfer in the morning for a blood test. And if infusion therapy is recommended, it can also be administered during the same visit together with a progesterone blood test. After approximately 3 hours, you return to the clinic for a Sanakin application therapy.
We all know that IVF treatment can be very stressful and emotional. Stress doesn't cause infertility, but it can reduce the chances of success. Overweight and obesity can also complicate the situation. Even a moderate weight reduction can improve treatment response and increase implantation rates.
As a part of our approach, we also offer a specialized reprometabolic program to help support your body before treatment. This program focuses on optimizing overall health, including metabolic balance and hormonal environment, to create the best possible conditions and increase the chances of success. This comprehensive program includes specialized laboratory examinations, consultation with our IVF specialist, consultation with a nutrition specialist, and personalized medication plan. If you'd like to learn more or see whether this program could be beneficial for you, I'd be happy to book a consultation for you with our doctors.
There are always many questions about vitamins and dietary supplements. We can recommend folic acid, vitamin D, omega-3 fatty acids, inositol, antioxidants like vitamin C, coenzyme Q10. But however, it's important to remember that no vitamins or supplements can change age-related egg quality or replace IVF treatment. There isn't always a single reason why pregnancy doesn't occur. Often is the result of multiple factors acting together. Please remember that human reproduction is a highly complex and sensitive process. You are not alone. We will be happy to help you as much as we can.
Okay, so we can proceed with the part for on your questions, and I will read the first one. So, can a normal AMH level mean that I still have a good chance after 40?
Okay. It's very important that AMH is normal. We can say it means that there should be a good ovarian reserve, a good number of eggs or sites. But by the age at 40, there's also very important that the quality of eggs could be unfortunately lower. Yeah. So in this case, if AMH is optimal to the age, I personally would recommend to do IVF therapy with PGTA. Yeah. It means we should have enough eggs, and then we could have enough embryos for the selection by genetic testing. Yeah. That's it.
Okay, thank you. Also, there is a question about endometriosis and how endometriosis affects quality of eggs and successful IVF.
Okay. Endometriosis doesn't affect only the quality of eggs, that's right, but it's not the only one effect. Yeah, it's also very important that endometriosis could or can affect also the quantity, the number of eggs. Yeah, for example, if there's any endometrioma cyst, or when the woman is after any surgery because of endometriosis. So that's the first factor. And then, of course, endometriosis also affect the quality of eggs. there are more factors or more influences. It could be something in the development of eggs, something like chronic stress in the cells, and then there could be a lower quality of eggs. But what's positive, we can say, is that in the most of cases we can be successful, yeah, but it could take longer time. But what's very important when there's the endometriosis in the medical history or like actual disease, it's necessary to solve it, yeah, and it's very good to use the method that we offer, I mean IVF, yeah, because it can very help to us.
Thank you. Okay, so now we have one question which is very detailed and long and including also a lot of medications and numbers. But in general, it's the question of a very high level of prolactin and how does it affects also the fertility treatment.
Okay. Okay, so what's important to say that high levels of prolactin can unfortunately affect also the natural cycle, the ovulation, yeah? So that's the first. If we are talking about IVF therapy, then it's very important to discuss it before with the endocrinologist, yeah? And to try to find the best therapy, best medication, and then to have or to get prolactin levels to the normal ranges. Yeah, it's not necessary prolactin to have in normal ranges. Yeah, if it's something like little bit higher, we can say there should be no problem. Yeah, but if the levels of prolactin are very
Too elevated.
yeah, then at first we should solve it with the endocrinologist.
Yes, yes. Okay, thanks. Okay, is IVF the best option when one has blocked fallopian tubes?
Okay, so in this case, when your fallopian tubes are blocked, we can say that the IVF is really the best method, and maybe we can also say that is the only one method. Of course, maybe we can also talk about any surgical, yeah. To možná tě, Marie, poprosím. Teoreticky bychom mohli uvažovat o tom, že o nějaké chirurgické nebo o metodě chirurgického zprůchodnění vejcovodu, ale tam prakticky ty výsledky nebývají dobré, takže určitě IVF.
Yep. I'll translate what doctor said, like in this situation when we have blocked tubes, sometimes we can do a surgery of tubes, like to try to unblock them, but these surgeries are not really successful. So what is recommended and easier path is to use IVF to achieve the pregnancy.
And it's much more easier, yeah. And what's important and what we should say that this case, it's one of the most easy or the best case for IVF, yeah, because in this case there's only something like mechanical problem, yeah, and we only need to take
to
eggs.
remove this problem, and like pregnancy is easy to achieve, easier than in cases when we have problem with eggs or with sperms or anything
That's
else.
it.
Okay, thank you. Then which supplements actually help? Is it really showing results to use, for example, Q10 or any other supplements?
Okay, so for example, for coenzyme Q10, we have some dates, and it could really help. It's recommended for older women, we can say, when we want to improve or to do the quality of eggs better. Yeah, so the effect is like antioxidant, and it has also good effect to mitochondria.
Mitochondria, yeah.
So yeah, I would recommend coenzyme Q10, and then we can also recommend other supplements, other antioxidants like vitamin C, vitamin E, or today we have often questions for NMD. Yeah, it's also possible to use, but for example, for this supplement, we have not so many dates like for coenzyme Q10. And of course, what we should talk about is folic acid is the most important. Yeah, and then maybe also vitamin D. Yeah.
Okay, and which kind and what kind of nutrition actually helps? Is there some kind of nutrition that can really influence the fertility?
Yeah, okay. So all of the medication or vitamins or supplements can help us, yeah, but it's only like support, yeah. What's the most important is the quality of the cells. I mean, also quality of eggs and quality of sperms. And by eggs, what's the most important and what plays the biggest role is the age, yeah. And if there is higher age and you will use all of these supplements, yeah, it could help, of course, but the age unfortunately plays
Is
the
key
biggest
factor,
role.
yeah. Yes. Okay. What to know? Wanted to know about IVF with your clinic. Can you transfer more fertilized eggs for opportunity for twins pregnancy? So, does we transfer more than one embryo per transfer?
Okay, tak.
We can transfer more than one embryo, actually, but we don't recommend it. There are many risks in connection with twin pregnancy, such as preterm delivery or high blood pressure in the pregnancy, or like preeclampsia or very low weight of babies. So like we sometimes do this, but in cases when a doctor estimated that there are like we had like
No
few or more,
contraindications.
no contraindications, of course, and also when we didn't achieve pregnancies a few times, so that to support or like to increase the chances for the pregnancies, even though these chances are not doubled when we do the double transfer, but they're like 15-20% more, and also, but there is also chance like around 15-20% to get twins. So we don't recommend it, but yeah, it could be done like twin pregnancy, but not more than two embryos.
Okay. Do all myomas need to be removed for the successful IVF? Lady said I had one in the uterus, but he could see showed it does not interfere with tubes, etc. So does all myomas
Yeah. Okay.
need to be removed?
So for the IVF therapy, it's not the question is not if is there the interference with tubes, yeah? That's not the problem, yeah. it could be only by the case when we want to be pregnant naturally. Yeah, that's it. But for us, what's important is the size of myomas, and what's the most important is the localization. Yeah, it's so if there, for example, the myoma could be also bigger, yeah, but if there's no effect to the
interfering,
yeah,
uterine cavity.
so there could be there shouldn't be no problem, yeah. So it's very important to have exact ultrasound, gynecologic ultrasound, to we know how many myomas is there, how is the size, and what's the most important, the localization. Yeah, and in any cases we can, for example, also recommend diagnostic hysteroscopy. Yeah, it's also important. Then we can really see how is the situation in the cavity of uterus. What's very important then for the implantation.
Yes. Okay, next question is from the patient saying, this is my first time attempting IVF. I had fibroids removed twice, and I feel like I'm experiencing perimenopause. 1 year ago, my AMH level was 12.1, so this is supposed to be picomoles. What are my chances of conceiving?
Okay. So the answer is easy. It depends on your age, yeah, because we don't know how is the age, and the situation will be different if you are, for example, 35, or if you are 45. Yeah. So the problem with myomas, if there were surgeries because of myomas before, there shouldn't be no problem, yeah, because it's really solved. But there's the question, how is the quality of eggs? AMH 12, it will be in picomoles, but also in picomoles it's not bad, yeah, but the biggest role plays the age. So that's the most important.
Yes, so the next question is somehow bonded to this, because is it possible to influence the genetic quality of the eggs in any way?
It's
No.
unfortunately it's not possible, yeah, as we were talking about it before, yeah. So
Yes.
it depends on the age, yeah. We can help, or we can try to improve, yeah, with medication, supplements, vitamins, with the whole lifestyle. That's it, yeah. But what's inside the genetic information, unfortunately, we can not influence.
Yeah. Okay, does it make sense to wait another year, or am I significantly losing my chance? Okay, this is not easy to answer because we don't have the number.
Yeah,
How
it's the
how
same.
old is the
we would
lady?
need
Yeah.
to,
Yes, but
yeah.
yeah, as we will answer all your questions also to email, she can write us her how old is she? Yeah. Okay. Okay. So we have a good sperm count and a hormonal profile. What else could be the problem?
Okay. Okay. So from the men side, yeah, it's also important to say that the spermiogram can be perfect, we can say, yeah, but it doesn't have to
also genetic of the sperms sometimes is not good. What we see is morphology, like we don't see inside the sperms as well, we don't see inside the eggs. That's why sometimes can happen that like morphologically and movement and count of the sperms is perfect according to the statistics that are saying that what is optimal, but also there are tests which can confirm, such as DNA testing of the sperms, which can help us to also see if sperms are genetically healthy or we have some part of the sperms which is not genetically good, and in this case there are also other recommendations for the treatment.
Okay, thank you, Mary. Okay, so what I also wanted to say is that if, for example, the man is younger, we can say the spermiogram is good, perfect. It should be enough, yeah, for us for the information. But if, for example, there's also higher age, or there were already any problems with fertilization or with implantation, with the development of embryos before, yeah, then also can help us to do another examination like Maria was talking about, yeah. So that's it, that's one side. And if hormone profile is okay, so it's also very important. But I don't know if it's complete hormone profile. It's very important to know how is the ovarian reserve, and we would need to know how is the AMH, anti-Mullerian hormone here, and then one more, the age of the women is very, very important, yeah. And of course then the third factor is very important, that's the endometrium, yeah. So that's the third, the three most important factors.
Okay, so one more question we have in chat regarding the high level of prolactin, and the lady asks if the prolactin affects the walls of the womb and make them slippery. Would embryo glue make a pregnancy more successful? Would embryo glue can help, and if that statement is true or not true?
When prolactin is high.
In my opinion, there's no influence
Connection.
or connection, yeah, between prolactin and with the implantation. I mean, with using of embryo glue. Of course, we can recommend embryo glue. It's also good. Another
help to
or
improve the chances.
Yeah, but for the prolactin, yeah, the most important is to solve it with the endocrinologist before. Yeah, it's important, for example, to do MRI examination. Yeah, and I know it's difficult. Yeah, but it's very important to find the best therapy, the best medication, and to try decrease levels of prolactin, yeah. And then if we will use embryo glue or not, the more important is that the levels of prolactin will be okay. Yeah.
Yes. Okay, and one more question also from our chat. Is what are some potential causes for 3 times cryo-embryo transfer implantation failure? 35 years old lady and with unexplained infertility, able to produce good number of egg cells and of grade A and B, 5 days blastocyst in one cycle, but could not achieve successful implantation. So what possibly can be more of the problem if the lady is 35 and has normal AMH and and blastocyst embryos? Yeah.
Okay, it's very important that's possible to have blastocysts with good quality, yeah, and the age is also good, we can say. So then what I would recommend if there were more unsuccessful embryo transfers and we have enough or we can have enough eggs, then I would recommend genetic examinations of embryos, yeah, and then to try to prepare the endometrium and all of we need for the embryo transfer the best we can, yeah, and then it's also recommended in this case to do the examination of reproductive immunology. It can also help us. Maybe I would also recommend the diagnostic hysteroscopy, and if we or if there are more unsuccessful embryo transfers before, it's also possible to examine the receptivity of endometrium or the some special cells in the endometrium to know if there's not, for example, chronic inflammation, yeah, and if there's, for example, normal range of NK cells in the endometrium. So I would recommend to do the genetic examination of embryos, and for the embryo transfer to do all of the examinations before, as we then have the best.
Oh yeah, we all have
Yeah.
overall picture of and maybe we find where is the problem, where is the issue before doing the transfer.
Okay, thank you. So, few last questions. Is it true that if an embryo is genetically normal, it must implant?
Unfortunately
No.
not. Yeah, the chances
Shortly
are
not.
higher. Yeah, but and what's important, there are lower chances or lower risk of miscarriage. Yeah, it's very important. But the chances for implantation or the chances for successful pregnancy will be never be 100%.
Guaranteed, yeah.
It's not possible.
As we say, human reproduction is around 40% in total, so there is always 40% maximum chance to get pregnant.
Okay. When does it make sense to consider donated eggs?
Okay, so what's we can say that it's in the case when we cannot have enough own eggs or enough own eggs with good quality. Yeah, so it depends on the age. It's the most important, but it can be also by younger women. Yeah, when if there, for example, the ovarian reserve is lower. Yeah, there's something, for example, like diagnosis with ovarian insufficiency, yeah. Or for example, when there was severe endometriosis, yeah, or any other problem, and we unfortunately cannot have enough of own eggs, we can offer then the therapy with donor eggs. Or then if the problem is not with amount, with the number, but with the quality in higher ages, yeah, then of course also.
Yeah. Okay, we have also one more question in a chat, but it was similar, already answered. So, lady is asking, with PCOS and blocked fallopian tubes, can you offer doing IVF with the chances of putting more eggs for twin pregnancy in your clinic? So, we commented on more embryos per transfer and twins pregnancy and also blocked fallopian tubes. So this is partially, I just wanted to read it so the lady knows that we have read it and saw it, but If she wasn't with us when we answered it, we will send the answer also by email.
And Yelena, and what we also should to tell when there are polycystic ovaries, yeah, then it's also possible that after the stimulation, there will be no possibility to do the fresh embryo transfer. Yeah, it's because the prevention of hyperstimulation. So it's also important to say. Yeah,
Yes.
And that's it.
Yes. Okay. And the last question for today, does PGTA really increase the chance of success, or does it just shorten the time to a result?
Yeah, the second is right.
second.
Yeah, it's because we cannot influence the quality of embryos, the genetic information. We only after this examination know how it is. Yeah, and then we can select the healthy embryos for the embryo transfer. So we can say we don't do zbytečný.
Yeah, we don't do like not necessary transfers with embryos which are not euploid or healthy. Like in this situation, we do another step of selection actually, where we select embryos which are genetically healthy. But you also need to know that it's not 100%. That's also important to know.
Okay, thank you. So we have two more questions. And also answered. So you will get our record of this webinar, so you can hear it also in the recording. Are there anything the couple can do, diet, supplements, etc., to improve DNA of the embryo before another cycle? And the other one is regarding the potential range of AMH level, the best potential range of AMH level. But we didn't get the units, only the number 7.8, so we are not sure if it's picomoles or nanograms, so we cannot answer. I recommend to a lady to write us, and we will answer for sure. So if we didn't manage to answer all of your questions during the webinar, we will make sure to follow up with you by email. And also we would like to remind you that as a part of our current spring offer, until the end of May, you can come to ask for a personal IVF consultation with IVF specialist, and it is free of charge now until the end of May instead of 210 euros. And during personal visit, you will receive an ultrasound examination, basic hormone profile, including TSH, level AMH, and prolactin. If you are booking such a consultation, please mention our code SPRING 2026. And also you will all receive all this information by email. For future webinars and updates, we invite you to follow us also on our social media channels, so you don't miss any important information from us. And thank you again very much for joining us today. We truly appreciate your time and trust. Have a lovely rest of the day, and we look forward to speaking to you soon. Thank you very much. Goodbye.
Thank you very much for participating. Bye-bye.
Bye.
Bye.
Bye.